that. The care for what we have heard, and I think we can't deny it, and it's very important that there is access from early age to the cures that are needed, but the preventive as well.
Thank you. My name's Trevor Shilton. I'm from the International Union of Health Promotion and Education, the IUHPE, which is a global society for health promotion. A lot of the questions so far have been about advocacy and mobilising change, and yet that skill set, that ability to advocate to the media, advocate to decision makers and politicians, advocate to mobilise our professional friends, mobilise communities and consumers, that specific skill set, it's both a science and an art in terms of how we develop the arguments, then how we shape them into persuasive communication. And we don't invest in it. That there's scarcely anything else you can invest in that would have such return on investment than to develop capable advocates among our professional colleagues and among consumers. So perhaps if you could reflect on that, I'm putting a proposition that actually investing in advocacy at this time when we're seeing implementation failure is a best investment. What is being done in that area? What more can be done in that area so that people like our panelists and everyone in the audience and people that suffer NCDs around the world can be better equipped to both make and win their argument?
I think it's a very good point, and I think I mentioned a couple of our partnerships where we try to collaborate with different stakeholders, both at local levels and also global institutions, in trying to build awareness and capacity, because we have for many years, if you look at the low-income countries, had pricing policies that makes our products affordable, but they do not get into the market because there's not a capacity to actually diagnose patients and provide care for them. And you can say, if you look at diabetes, obesity, also in the Western world, this is becoming an issue in a younger and younger age. So we need to be much better at actually articulate what is the issue and what can be done about it. So it's about making sure that we have a broad approach, as you say, and not go too deep. And we have a tendency of becoming maybe too data-driven and too scientific, too efficacy-driven. And it's a much broader approach that's needed. So I agree very much.
Great. Our next question is from Sir George Eileen. Thank you.
Thank you very much. First of all, let's say how pleased I am. As one of the godfathers of this NCD Child, let me say how pleased I am to see this. But let me go on to a point that Lars made, and I want to build on it and ask your reflection. Lars began to say, what I will do, what I will do. We have a lot of discussion of what other people will do. And one of the things I'd like to see challenge ourselves is what each one of us can do. All of us have agency in our particular sphere of action. All of us can do something. I take the point of professionalism, about professional health promotion, but in addition to being professional health promoters, each one of us in our circle of influence can influence people. Some of us can influence more people than others. Lars can influence larger numbers of people, but each of us moves in a circle in which we have agency, in which we can influence. So I like Beatrice's point with her school, what she says to people. Luisa talks about UNICEF, what they do. But in addition to that, I would like to see us challenge ourselves. When Benty was head of GCM, she pointed out in one of her programs what individuals can do. And that's the point I'd like to leave us to leave from. One of the issues, things I'd like us to leave from here with that message. What we as concerned individuals can do in our sphere of influence, apart from the professional spheres of influence in which we move. Thanks.
Thank you. I believe our next comment is from that table over there.
Okay, good morning. My name is Nasreen Qatamish. I'm from Jordan, the King Hussein Cancer Foundation. I'm happy to be with you today to discuss this hot topic. My question is related to the KPIs that we are using to assess our progress in fighting NCDs. We are focusing on cure rates, which should be the main focus. But when we are discussing the youth NCDs and the childhood NCDs also, I think we have to focus on the quality of life of people who are surviving these diseases and or living with these diseases. I mean, how we can reduce the harms and side effects of the treatment options that they are receiving, how we can work in reintegrating the youth and kids in their schools, societies, and so on. And if in cases of disabilities caused by the treatments, how we can ensure that they get access to quality education and quality care, and how we can also address the issue of psychological support, which is much needed by youth in specific after getting the different NCDs and after being treated with these NCDs. Thanks.
Well, I think this was a statement more than a question, and I think,
Yes.
as UNICEF, I can only say that I totally agree with you. And as we said before, the agenda of the SDGs, and if you look at the Secretary General Global Strategy for Women, Children and Adolescents Health, is now talking about 3 main areas which go beyond survival or fighting the disease. We're talking about survive, thrive, and transform. So there, the issue that you have raised in terms of quality of life, in terms of disabilities, and how we can support inclusion, integration, education are all there. So I can just say, great that you have raised this, because I think this is a very important area.
Great. So we had one next question from that table. Do you have the microphone? Yeah.
Thank you. Sorry for taking the floor twice. So I didn't introduce myself either. I'm Bente Mikkelsen. I'm the former head of the Global Coordination Mechanism, now director for NCD and Life Course in WHO Euro. And exactly, Sir George, we have to ask ourselves, what can I do from my position? And I would like to sort of pinpoint a couple of examples, because I asked the question to Luisa as well. In WHO Euro, we have just done a childhood obesity survey, and I think that's nice, but now we have to really use the data. And I can see that this creates a momentum. The same, we will launch now adolescent health and alcohol consumption. Use the data. And also coming back to Luke's point, this is one high-level meeting. We will have a couple of big meetings coming up. One of them is probably one of the most important meetings, namely to celebrate the Almaty Declaration, which is now 40 years, because that gives us an opportunity to look at one point in the whole healthcare system, namely the primary health care, where we can integrate. So the question is, have we influenced the declaration enough to really be able to see NCD as part of this? And the next step, also the universal health coverage, which will be the next high-level meeting. So I think we need to ask ourselves these questions. We are actually powerful, from Beatrice to me, to all of us. So thank you, Sir George.
Thank you. Again, I believe that was a statement. Yes, that was a powerful statement. Thank you. Now, before we close out our
We'll only say something if we disagree.
So before we close out our Q&A, I had one last question. I want to bring it to Miss Beatrice. The question is, well, first I want to predicate by saying that your efforts to raise awareness are incredibly powerful, and you are a great speaker, and thank you so much for raising your voice today. How do you think young people can use school and community settings to raise awareness about NCDs among young people and their families?
Well, I think that especially maybe it's different, but for my community, I don't know, like, I maybe know one person or two who have an NCD, and so the kind of topic of NCDs is not a popular one and no one really knows what it is. And then suddenly I got it and I was gone, and kind of it seemed maybe like I just disappeared, and then suddenly I came back and I looked different, walked different, couldn't do the things that I used to do. And I know that just me having it made my community more understanding and understand what life is like with one. And so I think that even someone advocating for it is someone getting more research and understanding of other people having it, and people